and then we'll get into pulmonology. So, okay, open up my notes and stuff. All right, cool. So yeah, so now we're going into the pulmonary system, which is connected to the heart, of course, because the heart's purpose is to circulate blood through our body, and the body or the blood carries the oxygen. So, of course, the lungs are a big part of that. So first we'll go over the anatomy of the respiratory system, which on the next slide we'll go over this picture here of the lungs. But we'll also go over the different types of specialties uh, related to respiratory care. So pulmonology is the healthcare specialty that details or deals with the respiratory system, any respiratory disorders. A pulmonologist is someone who is uh, in the diagnostic testing and treatment for certain diseases or disorders of the respiratory system. And then the respiratory system is divided into the upper respiratory tract and the lower respiratory tract. So we will look at that on the next slide here. But what a medical assistant does for as part of the respiratory system is we can perform peak flow tests or spirometry tests, and then also help with like nebulizer treatments, sometimes oxygen therapy, and other different types of respiratory treatments and care. But this is the anatomy of your lungs here. So you have the upper and lower lobes. So over it's kind of broken up almost like the same way as the heart has those four different chambers. It's kind of almost like the lungs have four different lobes. But yeah, so you have the right upper lobe, the left or right lower lobe, left lower lobe, and left upper lobe too. So um, the left upper lobe is not as high as the right side. So, and the reason is because you have on the left side where you have to make room for your heart as well to sit in that area. So, and all right, so the upper respiratory tract. So it's also a part of the upper respiratory tract involves the nose and the larynx. And the main functions are warming and cleaning of inspired air. So when you're breathing in, it kind of warms up the air into your lungs. So if have you ever been outside where it's like really cold and then you breathe in and it kind of feels like just this tightening feeling in your chest? Um,
Mm-hmm.
Part of what the respiratory system is supposed to do, or when breathing in through your nose and it's going into your larynx, is to kind of help warm that air so it doesn't cause inflammation in your lungs. So
Mm-hmm.
the pharynx is divided into three different sections. So you have the nasopharynx, oropharynx, and laryngopharynx. Um, so basically your nose, mouth, and throat, which is how we breathe in. And did you know, by the way, that you only breathe through one nostril at a time usually? And it
I
switches
did.
sides through the day?
That's so weird, though.
It is very weird. It's
Is that?
not, huh?
I was just wondering, like, when you get a cold and it's always like one nose is usually blocked.
Mm-hmm.
Is that why?
Yeah, because sometimes if you notice, like when you have a cold, one side, like say the left side, you can't breathe through, it feels clogged, and then all of a sudden it's like, now
It
it's your
clears
right
out.
side.
Yeah.
Yeah, it's kind of like sometimes you don't really notice it until you're kind of like, wait, I could breathe through that side earlier. Why? So, but it's just kind of a random fact I guess I didn't think or realize about. But it's kind of true because if you kind of feel below your nose, you'll still feel like a little bit of air coming out both sides, but you'll feel more coming out one side than the other. So
Yeah.
it's kind of weird.
Yeah.
So, but yeah, so the lower respiratory tract consists of your trachea and the bronchial tubes into the lungs, and then the bronchi are divided into smaller branches called bronchioles. Sorry. The right lung has three lobes, and the left lung has two. Again, the left side, that's because of the heart. It's got to make some room for that. And then inspiration is when the diaphragm is pulled down and flattened as it contracts. And then expiration is when it relaxes and moves upwards. So basically, breathing in, your lungs expand, and breathing out, they contract and don't take as much space in your diaphragm. So yeah, this is all connected here. So your nose and throat actually do connect together. So sometimes have you ever done one of those like neti pots to clear out your nose before?
No, I'm too scared.
Sometimes some people have noticed when they've done that, they have such like strong congestion that it doesn't go out the other side. It can't like go through one nostril and out the other. It sometimes can come out through their throat, which is kind of gross, but that's because when you are flushing out your nose, it's connected to your throat here. So then it can kind of come out that way too. But you also have the sinus cavities, up here too. So a lot of times when people feel like that congestion and that head pressure, like in the middle of their head, it's because they have that sinus cavity there as well. So it can be also just filled with a bunch of gunk and stuff. So, yeah, so this is kind of what I was talking about, the branches of the bronchioles. So it comes off and it kind of almost does look like a tree, but and we'll get into further to like the areolas and all that kind of stuff in your, or not the, I'm sorry, that's not the right word, the oh, it sounds very similar and I don't know why I can't think of the exact word now, but we'll get into the other parts too, of like the ends that hold, like at the very ends of each of those little branches,
Yeah.
there's these
I
little,
I know what you're talking about.
yes, and I don't know why I didn't, that was not the right thing, sorry. um But yeah, right in here is the space that's occupied by the heart. So that's why on the left side, you have a little bit more of an opening here. So it can give space for the heart. So, all right. So the lifespan of the respiratory system. So as an infant, you have a narrow airway with a short and softer trachea because infants tend to breathe mostly through their nose. They breathe a lot faster than an adult. It's kind of with their heart rate too. The younger and smaller you are, the higher heart rate you have, and the higher heart rate you have, the more oxygen you need. So, yeah. But the lungs reach their official maturity rate or age at 20 to 25. So you still, basically your lungs are still developing throughout your life until about 20 to 25, and then it's not that they're not like fully developed, but they don't need to, I guess, develop. I guess they are kind of like not fully developed, but for the most part, I mean, your body always kind of changes, kind of like how your bones are always going to continue to grow and things up until a certain point. And that's pretty much what this is too, is it's like the way that your body is building that structure and everything. At the age of 20 to 25 is when your body's like, all right, this is fully done. So but at age 35 is when lung function can start to decline, especially people who are smokers. That will, of course, damage their lungs and make that decline a lot faster. So, okay. So, of course, the functions of the respiratory system is to exchange oxygen from the atmosphere and then release the carbon dioxide that is the waste, after we absorb the oxygen. So, it helps to maintain the pH balance in our body, or that acid base in our body. So it is filtering out any of those, all of those toxins and things that we have in the air. It's kind of filtering out exactly what it needs for the body and then getting rid of everything else to an extent. So, and that's kind of what part of the circulatory system does, is there's certain cells that then bring those toxins to the liver to get rid of, but you still get a little bit of a buildup over time of those things. So, and that's where certain infections or diseases or disorders can happen. So, okay, so the two types of respiration during ventilation process. So the external respiration occurs when oxygenated air moves into the, this is, I don't know why, the alveoli. That's that's why I was kind of like, that's not the right word when I said that, but I was like, but it's so similar and I can't think of the word right now. Oh my gosh. Anyways, um which is those little parts that are at the end of each of the bronchi, those little branches.
Mhm.
So that is kind of what like filters out, and then also moves or that's where the blood goes and kind of takes the oxygen and moves it back into the heart. So, and then internal respiration occurs when oxygen is exchanged from carbon dioxide between the cells in the body and the blood. So kind of getting rid of those what the body does not need. So, oh my goodness, I can't believe I mixed those two words up. As soon as I said that, I'm like, that is not the right word.
They sound very familiar, like similar though.
They do, yes. That's what I kind of got confused, and then I was like, that's why can't I think of the actual word? But
I got a
anyways,
little confused when you said it at
yeah. Um Okay, so inspiration. So a healthy person breathes when blood carbon dioxide levels increase. So sometimes, like if you are breathing heavier, certain activities and whatnot, your body is trying to get rid of that carbon dioxide waste. So because your body, the blood, is pumping through your body and taking that oxygen from the red blood cells, and the more active you are, the more certain areas need that oxygen. So that's why your heart starts beating faster, and then you start breathing heavier because your body's needing more oxygen in those areas. So, and then expiration is the second half of ventilation. So, of course, that's where we are then breathing out any of, or the carbon dioxide basically. So yeah, so our respiratory system helps to get rid of some of those toxins, but then so does your blood system as well, because they're also going to be carrying anything that the body does not need to be excreted out as well. So they kind of both work in that way. Um, but yeah, that's where the carbon dioxide gets rid of, or is excreted through the body, is through exhalation. So, and when it's talking about the pH balance or the acid base balance, so it's the pH stands for potential hydrogen. So it needs to be within a certain balance, so that way it's not too acidic, or it's not too, I mean, really, like the
first.
higher, what's that?
Yeah. Like basic. Is that what it's called? I don't know. Ignore me. I'm just. Go ahead. Go ahead.
You're good.
Go ahead.
Yeah, but it's regulating the amount of carbon dioxide, because carbon dioxide is more acidic, and we need to have more of a neutral balance. So anything less than 7 is considered acidic, and then anything greater than 7 is actually pretty good. So you actually want it above 7. The higher or the more not acidic,
The
the
better.
oxygen is, the better. So yeah. Okay. So, some different signs and symptoms of a respiratory disorder are apnea, which is kind of where they stop breathing for certain periods of times. Cyanosis is the one we were talking about before, where they kind of get a bluish tint to their skin. Most people, you'll notice it in like their nose and their fingertips, because you have such small little veins and capillaries there. So those are going to be kind of the first areas you'll notice of someone who is cyanotic. Dyspnea, where they're short of breath.
Did you get
Um,
my
where they are either like having the like hyperventilating where they're breathing rapidly, pleurisy, stridor, which is different. These are different kind of breath sounds that I would need to show you, like the difference between a stridor and wheezing. Because they are definitely different, and
Yeah.
it's kind of because it basically kind of caused by the same thing. The bronchioles are kind of inflamed, but they definitely sound different. So I'll have to find a video to show you guys that. So, but we'll go over a couple disorders or conditions of the pulmonary system. So allergic rhinitis is what happens usually when someone dust, animals, pollen, dander, certain things like that. Usually this happens in the summertime because most people have that allergy to pollen. So they'll have itchy nose, eyes, throat. Sometimes they'll have, well, they'll usually have the watery eyes, sneezing, and they might have the redness to their nose, but that's not always like as prominent. But they'll have like lots of congestion, coughing. Sometimes they'll have a sore throat because usually in the morning is when they'll have the sore throat and the coughing, because when you lay down, all of that everything, all that congestion is kind of going down the back of their throat. So, but then they might have like dark circles under their eyes or puffiness, and then fatigue and headaches. So that's a pretty common symptom of allergic rhinitis. So they won't have like a fever because they don't have like an infection or anything like that. It's just simply a reaction from your body because of an external source. So your body's just trying to, it's not liking all of that extra stuff going on. So asthma is a chronic disease that affects the airway and comes in episodes. So someone, they have asthma, but obviously they're not having an asthma attack or anything all the time. So in general, they are able to breathe just fine, but then certain things can trigger an asthma attack. So when someone has an asthma attack, basically what's happening is in here, this is what it looks like to have a normal, let me kind of get this a little bit bigger. So this is what it looks like to have a normal airway. So it's pretty open, air is easily flowing through. And then someone who has asthma, so this can be, they might have a harder time breathing than a normal person in general because there is some inflammation. But some people are only triggered by certain things, so they're not always going to be short of breath or anything. But this is what someone who's having an asthma attack, this is what it looks like, because you can see that there's a big difference from the amount of volume of air that you're able to absorb. So they'll usually be pretty short of breath. Sometimes they'll have chest tightness or pain, and then they will have either coughing or wheezing. Usually the wheezing is going to be one of the signs that you notice the most. So but different things can trigger someone's asthma. So certain environmental causes. So sometimes it could be someone who is wearing a strong perfume, which causes their airway to kind of restrict. It could be due to allergies. It could be to strenuous activity. So if they're working out and then their airway starts to constrict. And then sometimes can be from an emotional distress. So if something has triggered them where, it's usually pretty devastating type stuff where they are having a very, oh, what do I want to call it? They're having an emotional, I don't want to call it like an attack or episode. I can't think, but basically something in their life that has triggered some type of strong emotional state. So sometimes that can cause someone's asthma to flare up. And the different treatments for that would be some people, they can use a rescue inhaler, which basically is kind of like a steroid. It opens up the airway. And sometimes people have to use a nebulizer, which is a which we'll get into later on this week of like the nebulizer treatments and everything, but it's basically a metered dose of a certain type of steroid that'll open up the lungs too, because the rescue inhaler sometimes doesn't always work. So all right, so COPD. So this is something where someone, where asthma can kind of come by certain flare-ups, where COPD would be something that someone has basically all the time. So where they're going to have that restricted airflow. So there's two different types. There's like emphysema or chronic bronchitis that are what cause the chronic obstructive pulmonary disease. The main cause of COPD is usually people who are longtime smokers, and that's because it's just continuously damaged their lungs over that time. So their body isn't able to kind of, you have this buildup of tar and everything in your bronchioles, and makes it a lot harder to breathe, of course. So it does make someone have a lack of energy and fatigue, because pretty much doing most things is going to cause them to be out of breath a lot faster, and that just makes you pretty tired. So, and this is what it kind of looks like for someone who has COPD. So this is your normal lung or healthy lung over here, and then this is what someone who has COPD has. So you can kind of see it is much darker than the healthy lung, so it's kind of got a brownish color rather than the pinkish color. There's air that can get trapped inside the lungs here. The bronchial tubes can become inflamed and then get narrow, and then there's usually a thick mucus that forms on the inner walls here. So it's harder for them to breathe in and out. So, and this is what a healthy lung looks like versus someone who was a smoker. So you can kind of see like someone, they don't, whoop, no, go back. It doesn't, they're not absorbing as much air. So, but other hazards of tobacco products are heart disease, lung cancer, throat cancer as well. And you have a higher increase of a chance for a stroke or hypertension. So, but it has all sorts of effects on the body as well. But as far as the respiratory system, it can cause heart disease and lung disease, or throat cancer. So, and even like secondhand or third-hand smoke can also be harmful to a person. So someone who is not like directly smoking but is around someone who smokes, that can also cause someone to have, their lungs will also kind of develop and get that plaque build up like the smoker does as well. So okay, so cystic fibrosis is a life-threatening disease that is a congenital disease, which signs and symptoms would be a higher than normal levels amount of salt in the sweat, so like an electrolyte imbalance, someone who is coughing pretty frequently and producing really thick mucus, or tends to be pretty short of breath, and then so they're not their growth as far as like height and weight, they're not growing at a regular stage. So this is what it can look like with someone who has cystic fibrosis. So you have in the alveoli, make sure I have that right. So it causes like this blood and mucus that's inside of the bronchioles here. So, and then it also causes some inflammation in the alveoli. So, and you usually can get a good look of this on on an X-ray. So throat cancer was the other part that can happen with, and it doesn't necessarily have to be something that's like related to tobacco, because someone can get the laryngeal or throat cancer through alcohol use as well. So it doesn't have to be just tobacco, or someone also who's worked in like mines or areas where there's like lots of dust and things. So if they weren't like wearing a mask, they can develop this throat cancer, which this is kind of, I mean, it basically will look kind of like, dead tissue. So, but a
So,
little. Oh, go ahead.
how does alcohol cause it?
Alcohol basically, because when you are swallowing the alcohol, it causes like a burning or damages the tissue
Okay.
in your throat. But alcohol can also cause uh, cancer of other areas as well. But that's what it was saying, like with in your throat specifically, because as it's going down, it kind of is causing damage and inflammation
Mm-hmm.
to your throat and your esophagus.
Okay.
But throat cancer can impact your vocal cords. So if you've ever seen those commercials or maybe seen someone who has like a little hole in their throat and sometimes has
Yeah,
this device
someone
that
has
they
the
use.
puncture.
Yeah.
Yeah.
But some signs and symptoms would be someone who has a persistent sore throat, um, pain and swelling in their throat, ear pain, or sometimes like they might notice a lump in their neck or throat. So let me see what else. Okay, yeah, these other ones I was going to go over on Wednesday, or I'm sorry, Thursday. But yeah, any questions so far?
Is cystic fibrosis is it curable?
Hmm, I I believe so. Let's see. Let's see what the treatments for cystic fibrosis are. Let's see. Okay, so antibiotics, bronchodilators, which just will help open up
Mm-hmm.
the airway. Um, things that'll help moisten and the mucus, so it helps to kind of get rid of it. Um, and I'm pretty sure too, sometimes going to a pulmonologist where they may do certain breathing exercises with them may help as well. But it's usually something that affects um, like young children.
Yeah.
So yeah, treatments and therapies too. So let's see what else this says.
I'm sorry, I kind of forgot already, but what causes it?
It's something usually congenital, so passed down through birth, but I'm not sure why that happens exactly. Let's see. Mm, okay, so it's some type of so again, it's like a genetic or inherited type of disease. So it's some type of mutated cells that happen. So it's something that has to be passed down from their parent. So if they're say like their parent was had cystic fibrosis, their child is more likely or will most likely have cystic fibrosis as well because there's some type of um, mutated gene that
Mm-hmm.
gets passed down.
Okay.
So
Interesting.
yeah, some type of defect or yeah. But yeah, it's so it's a congenital disease that they usually have at birth. So that's why like when you work in like pediatrics, pretty much every time the child comes in, which for the first year of their life they're going to be coming in pretty frequently. So you always measure them and check their weight, and that's
Mm-hmm.
kind of an indicator if they have cystic fibrosis is um, if they're not gaining weight or they're not growing like they should be.
Right.
So yeah,
Okay.
but yeah, any other questions or anything?
Um. Actually, yes. I kind of have this problem where I'll learn the material that we go over,
Mm-hmm.
but then over time, if I'm not reviewing it, I kind of forget it. So I was kind of wondering if I'm gonna think about going back to like the beginning and just starting to review things. And I was wondering if maybe you could like send me the PowerPoints for the different sections if like they're not there already.
Yeah, yeah, I can do
Okay,
that.
I'll like send you like an email or something. But
Yeah. Yeah, I know that's kind of how, as you're moving forward and stuff, it's like something you learned 3 months ago, all of a sudden
yeah,
is like, wait, I don't remember that.
yeah,
So I'm kind of trying to create like games and stuff too. So it's like randomly through the course, it's like something that we did a while ago. We can do like a Kahoot or
mhm,
Quizlet or Jeopardy game or something just so it helps to kind of keep that information. So
yeah, yes, those have been really helpful by the way.
I
The
think they're
Jeopardy
pretty
stuff.
fun.
Yeah, I think so too. Okay,
So,
yeah, I think that was it.
all right.
Thank you, Caitlin.
No problem.
Have a good day.
You too.
See you Thursday.
Bye.
Bye.